You'll know when that goes.
Oh. You gonna say good afternoon, everyone?
It goes right at 3 o'clock. So.
Oh, oh, really? Okay. Didn't start?
No.
Yeah, there we are. Okay. Good afternoon, everybody. This is Julia Lewis and Jan Bigelow here to answer your questions. We have the ability now to go through the questions you submitted over the weekend and today. But we also, if you have questions, you can call the main number, ask for Tish Burke, and Tish will write the questions down and text them into us. So you can have your questions answered right now if you haven't submitted them in advance. Jan's going to take the floor and go through the questions you've already asked.
Okay, thank you, Julia. Good afternoon, everyone. We can't see you, but hopefully you can see us. And we do want to answer all those questions. We have a support team helping us. So thank you to Colin and Andy and Kent and a variety of other folks that are helping us bring this live to you. So we do have some questions, and we've updated the information that you've already received from Julia. We have updated that information with new questions. So hopefully we will be clear enough in answering each and every question. If not, please continue to get your questions to us. We will be glad to do this again or as many times as it takes for everyone to feel comfortable with what's going on. So question number one was, how will deliveries be handled, and are all deliveries okay? So you read about Amazon and UPS. These deliveries for the time being will be handled at the front desk. I would say that the things that have changed is there is a process in place now, and Keith and his staff at the reception desk, along with leadership, are trying to put the following process in constant use. So staff will hold all deliveries that are not perishable for the required time period. So we've been given some time periods where the COVID virus stays on certain surfaces. So cardboard is 8 hours, plastic is 72 hours. So what we will do is we will be holding your deliveries at the front desk. And then after that allotted amount of time, we will call you and let you know that you have a package available. If you can't live without your package and you have to have it, we will assist you in trying to get the package sooner, and we will transfer the contents out, and you can take them that way. So what we're trying to do is reduce exposure. So if the COVID virus continues to live on the cardboard for 8 hours, we really don't want that coming to you, but our staff can use gloves. We can take the contents out of the cardboard box and put them in a tote bag that you would be taking with you. Yeah, so I did that on down. So groceries is next. Publix is still delivering. They deliver in plastic bags. If you place an order, please notify the appropriate front desk. When the delivery arrives, bring your cloth or plastic, whatever you have, tote bags down. We prefer cloth. And the staff will actually transfer the groceries for you. So again, we don't want you touching or being in contact with the plastic that comes from Publix, but our staff have gloves. We can take that contents out of the bag, put them into your cloth tote bag, and then you can take them back, or we can assist you to get those groceries back. I had a question. Is it okay if I give my canvas bags to my son to do the shopping for me? No. We do not want canvas bags or bags of any kind given to your family members to do your shopping. They must be dropped off in front of the buildings, and then a transfer will be made by the staff that I just explained. Our goal is for staff to do as much as possible so that you don't come in contact with anything that's not necessary. At this time, Walmart and Target have discontinued all deliveries, so they are not delivering anymore. So at this point, it's Publix. I don't know if there's some mom and pops that might still be delivering, but we will help you to transfer that. We are also asking you not to order any food items to be delivered. These deliveries are unacceptable at this time. You can get meals through our Wonderful Dining, our culinary department, and they will be glad to put you on that rotation for meal delivery. Can one order an occasional meal? No, you cannot. What we want to do is we want to enable you to get the food that you need from our culinary department. No less than 15 meals, so you have to join the 15 meal plan. I've had some questions about, well, I'm not on a meal plan. If I join the 15 meal plan in March, I will be charged for the meals that have been delivered in the month of March. So you don't need to be charged for the plan, something like that. For those already on a contracted meal plan, as part of your contract, you will be charged a FOB meal, just like you normally would be charged. We also cannot have people changing from day to day. So if you sign up for the 15 meal plan, you're obligated to the 15 meal plan. Orlando is saying that they don't want people to be skipping around. So 1 month you're on a 15, 1 month you're on a 30. I've talked with Kenny, and as long as we know far enough ahead, so if you want to change, you're in 15 meal plan in April, you decided you want to do 30 in May, if you contact Nellie and fill out a different form, or the forms that we ask you to fill out, if you come and fill out a new one, then we'll make that happen for you. Or 60, right? So 15 meals, if you decide now that you'd rather have 2 meals a day, you can sign up for the 60 as well. We just don't want people signing up for any less than 15. Meal deliveries will be made every other day. So starting today, I think they actually start on Saturday, but starting today, we are delivering every other day now moving forward. So this week it'll be Monday, Wednesday, Friday. We will be delivering 2 days worth of meals between the hours of 9:30 and 11. So please, please, please be available for those deliveries. We have had people not there, and we have to keep going back to deliver your meals. So it just takes a lot of time on the staff's part to be able to do that. So we appreciate you being home to receive those deliveries. During this time, we will not be having breakfast. We will not be delivering breakfast of any kind. So you are definitely on your own. If you're a breakfast eater, you'll be on your own for breakfast. Every independent resident must complete the dining delivery form. So if you have not completed one yet, we need you to do so. It was by 9 o'clock this morning. If you have not done that, please get those to Nellie ASAP. If you don't want meals, there is a place on those forms to decline meals, and we need you to sign those forms for us. And until the foreseeable future, we will not be doing any end of the month meal exchanges for unused meals. Any other questions that you have about meals?
No, I think the issue was raised about why couldn't they trade unused meals when there's grocery store open?
Yes, and that is not going to be the case. And I have that addressed right next. So the basic staple grocery store, which is what we've talked a little bit about creating, is in the planning process. But Julia and I heard on a 1 o'clock phone call that they will have this up and running by the end of this week. And it will provide staples such as canned foods, juices, milk, eggs, toilet paper, paper towels, and it will be for the use of residents and staff members as well. So we know that our staff are struggling to get supplies. We are going to do our best to be able to provide for the staff as well. And those will be billed accordingly. So they will be billed with your FOB at the end of each month. And So if all goes well, that'll be up and running by the end of this week at each of the campuses.
I think they're also going to include toilet paper and some cleaning supplies, some basic cleaning supplies.
Absolutely. So, we don't want it to get too big. We don't want to end up being a grocery store, but at the same time, those basic staples are things that everybody needs. So if you are not feeling well, if you feel that you are a little under the weather, you're maybe showing signs and symptoms of the COVID virus, which would be your fever over 100, coughing, help me. Dry cough. Please make sure that Kim Sandoval, our health resource nurse, is notified. If Kim is not here, make sure you're calling down. We don't want you coming down. We want you calling down to the receptionist desk and making sure that we understand. The other after hours, right? So the other thing that's really important for us right now is the SARA system check-in. So we always ask people to check in between the hours of 6 a.m. and 10 a.m. We are having some folks say, well, since we're not allowed out or we're not leaving our apartments, we don't need to check in anymore. Now more than ever, we need you checking in. So we still do have a handful of people that we're having to call, which takes a lot of time on from the staff, and we just are asking everybody to make sure that you are checking in through the SARA system every day between the hours of 6 a.m. and 10 a.m.
You know, what about if they have symptoms, but the severe symptoms, like they having difficulty breathing?
911.
911.
911 for sure. 911 will respond. At the present time, any resident who is suspected of having a diagnosis of COVID-19, and remember, COVID-19 symptoms are very close to flu-like symptoms. So anybody with those type of symptoms will immediately be transferred to the hospital. So the next question, what happens if I leave the building to walk along the waterfront? What if I have to get in my car and go to the grocery store, anything like that? We are asking everybody to come to the Palm View desk or the Palm Center desk to be your temperature taken and a screening form. So if you leave the 2-block area of our campus for any reason whatsoever, we are asking you to follow the rules and come back and make sure that you touch base either at the Palm View desk, and those reception hours are from 8:30 a.m. to 9 p.m. So if it's after that time and you're a Palm View resident, you will need to go over to the Palm Center desk, and someone is there 24/7 at that desk.
That might be not a receptionist, but security.
Could be security.
And they will take the temperatures and have.
Yes, exactly. So again, please, no one is exempt from this screening. So if you feel that you live in Palm Bay or Palm Isle, you're away from things, you folks, we're trying to protect the folks of St. Pete as well. So Palm Isle, Palm Bay, Palm View, Palm Center, and Palm Air residents all need to be screened if you leave the 2-block area on our campus. Also, if we close down a certain area, such as the fitness room, Colin is not there to police it all the time, but people are watching. We do have cameras, and it is not okay to use those. If we've closed down and say we do not want you using the fitness space, the expectation is you will not be using the fitness space. We do have a letter ready to go. We've had some people say, well, what if I don't abide? There is a portion in your contract that states that we can put measures in place to protect our other residents, and we are prepared to do so if someone is not following a quarantine that's been put in place for them, or they're not following the precautions such as screening that we've actually put in place as well. The garage situation, you will have to come through the front door at Palm View to make sure that you are screened. If it's after 9 o'clock, as I stated, you would be expected to go to the Palm Center desk. Can we still use the libraries? What about doing jigsaw puzzles? All activities on campus, including social interactions, we are asking for social distancing. So if 3 people are already in the library and you cannot be the 4th person because there's not enough 5 to 6 feet between you, please postpone your visits until somebody leaves the library. But we are leaving the library open at this point. If we find that people are not doing what they need to do via the social distancing, then we will be closing those as well. But we really don't want to because it's a good time to read books. So just Julia. Okay. All right. Very good. So we're getting hints as to how to do this. So bear with us. All right, so let's talk a little bit about social distancing. I still see people very close. Julia and I have placed ourselves far enough away that we're not going to spit on one another, and I don't mean to be so precise, but yes, but that's how it's transferred. If you're talking with somebody and they actually saliva hits you, you can easily spread it that way. So social distancing is one thing that we are putting in effect that will definitely slow the process of this COVID, the spread of the COVID-19. 5 to 6 feet apart is what we consider social distancing. Trust me, I love you all very, very much, but please don't get closer than 6 feet to me. Don't get closer than 6 feet to the staff. I have seen people get very close. You know, we're going to have to be rude, and we're going to either have to tell you to keep your 6 feet, or we're going to be rudely backing away every time you're coming towards us. You know, we have families to protect as well, and we are doing our best not to spread the virus as well. So we do ask out of courtesy to make sure that everybody's keeping that 5 to 6. We've had a question raised about the elevators. Social distancing would be in order there as well. So Julia and I rode up on the elevator today. She stayed in her corner, I stayed in my corner, and all was good. But you can't have more than 2 people on those elevators at a given time. I know it's going to take you a little longer to get to your destination, but it definitely pays to be safe. So I want to share this statistic with you. And I'm not sharing a lot of statistics because the last thing I want to do is scare people. But at the same time, I need for you to understand how critical following the precautions is for all of us. So many of you by now are familiar with the Seattle, Washington nursing home that was affected by the COVID-19 virus well before probably many of us even knew what it was. The CDC came in to investigate that, and they will be coming into all communities that have the COVID-19, and they are able to track it back to the person, and they were able to track it back to the one person that brought that virus into that nursing home. It then spread to 119 other people. So one person brought it in, it spread to 119 people, and there's been 29 deaths to this point, and more to come, I am sure. So the virus is serious. It's serious stuff. It latches on, it spreads, and that's why we're being very diligent, and we are making sure that folks are following the precautions. Next, home health, home care nurses and aides from approved agencies only. And I state that, approved agencies only are permitted in the building and in your apartment. Any questions about approved agencies should be referred to Kim Sandoval or myself. And all essential home care will need to wear masks and go through the screening protocol at the front desk. So what I just said, essential is the key word here. Medically necessary. Some of you have home care. Some of you have home health services coming in to address a wound or something like that. Those folks, we still are allowing them to come in as long as they wear their mask and they are put through the screening process. housekeepers, longtime friends. You've known them for years. They've always helped you. Unfortunately, they are not considered essential, and we will not be permitting them to visit. And they do fall under the cannot visit. So the other piece of that is housekeeping. Many have been asking us to provide vacuums, mops, brooms, buckets. We cannot do that. If we were to supply a vacuum cleaner and people have said, can we borrow it? Can we sign it out? Every time that would be returned, we would have to go through a major process, including changing the bags out after every use. We would have to clean canisters and disinfect. The problem is we are using those vacuums on a regular basis because we still are cleaning common areas and we're still in our nursing home and our assisted living. So we are not able to do that, but Little Elves have been checking, and all of this stuff is available on Amazon. You can get it delivered, sometimes next day delivery. There's mops, there's vacuums. If you need assistance, we can help you set up an account. Colin, Andy, all of the staff are good at those kind of things. We'll be glad to help you set up an Amazon account. So we will not be at this point in time providing. So Colin, before you leave, the barbells. We have said that people could check out. Okay, so you're going to bring them to
Yes.
you. So you're going to let people take the barbells.
Yes, yes. People can check out some of our equipment. I will bring them to your apartment completely desanitized, and you'll keep them until the end of this, and then we'll get them back. You'll have a slight waiver you have to sign just in case you lose them or anything like that, but that is the process.
Okay, good. Good. Yeah, we've had those questions, so good.
I
Thank
want to
you.
go
Colin.
back to the vacuums and all. If you can't, I mean, it's might be a possibility, do you think?
Well, again, Walmart's probably one of the worst places you can be going,
That's
other than
true.
a physician's office. I really don't want to encourage
Okay.
people going out. Amazon is the easiest
It
thing,
is,
really,
it
or
is.
Walmart. I think you can order online from Walmart and they'll deliver a box. Is that correct, Andy?
Yes.
Okay. All right. They just won't deliver groceries.
Oh, okay.
yeah, right.
So I did check on Walmart and they have vacuum cleaners as cheap as $29. So you could get your own vacuum cleaner and have it for the length of this crisis. It will keep it, of course, if you buy it.
Mhm.
Similarly, their mops and their pails are not expensive.
You cats at home, I use my dust buster a lot, so you don't have to pull the vacuum cleaner out. All right, so a couple additional questions, and these are new questions. So when will this all go away and we can get back to some normalcy, such as transportation, housekeeping? Folks, I really wish I could answer that. I am by no means God. I have no idea. We are hearing, and Julia and I heard today, that this could last up to 18 months. So we are really looking at 30 days at a time here. At this point in time, we know that we will be delivering meals at least for the next 60 days. So it is not going to be anytime soon. I am going to be an optimist, and I'm going to be saying that maybe by late summer, we can get back to some sense of normalcy. But I really, truly don't believe that we are at the worst yet. And I'll tell you, I definitely expect that in St. Pete sometime this week, they will be closing down all non-essential businesses. I think some businesses have already decided to shut themselves down. But you know, we're going to have grocery stores open, we're going to have pharmacies open, and we're probably more likely going to have physicians' offices open. And that's probably going to be about it, other than hospitals. So, you know, I wish I could say it's going to be soon, but I really don't believe it will be. I've had a couple concerns about the staff. Thank you so very much for that. We love our staff, and we are, as Westminster, doing absolutely everything we can. We are not laying off anybody, and we have no intentions at this time to do so. We are doing our best to repurpose staff. So what that means is if you're a driver, you're no longer a driver. You might be helping us deliver meals. You might be helping us take temperatures at the front desk. You know, you might be assisting Andy's group with activities, those kind of things. So we are trying our best to repurpose staff and get them their established hours, especially if they're full-time. Staff right now, they're being very vocal with us. They're thankful to have a job. So, and we are doing our best to keep them. Many of their family members are losing jobs every day. And so kudos to the Westminster senior leadership for their efforts to keep all of our staff and to be giving them hours, even though we don't necessarily have enough for them to do. We as leadership and as co-workers are really looking to keep them very busy. So the other question, which was very much appreciated, was what can residents do to help staff feel supported and appreciated? The first thing you can do is don't kill the messengers. So we are all following CDC guidelines, which are federal guidelines. We are having state guidelines and precautions thrown our way, as well as county. And we're being asked to carry those out. So first and foremost, don't get upset with the staff. Don't kill the staff. Don't get frustrated with the staff. We are doing our best to do our jobs, and that's to keep you all safe. And my job as well, along with the senior leadership here, is to keep the staff safe as well. Abide by the precautions. I know that my staff is reporting to me on a regular basis that they're still arguing with residents. They're having a lot of questions. Why do I have to do this? It's just not fair. As I said, we are putting guidelines and precautions in place that are given to us by federal, state, and local authorities. And, you know, don't waste the staff's time in making them chase you and, you know, chase after you for doing things you're not supposed to do. So the other thing is you can always recognize staff for going above and beyond through the Legendary program. That's huge. And you have no idea how much the staff appreciate that recognition. They are recognized in front of their peers. So that means a lot. And, you know, last but not least, prayers for the staff and their families would be greatly appreciated. And we know that this is a tough time for everybody. We need to take it seriously. We would not be enforcing these rules if we didn't have to. You know, we are doing our best to keep it away for as long as we can. I'm not making any promises that it won't hit Westminster. It's going to hit Westminster. But if we're taking the precautions, it will be minimal as opposed to a major catastrophe. You know, the more people that are treating it lightly and saying, well, you know, I'm not going to get it, or this doesn't apply to me, only makes our job harder, and it puts at risk more folks that we know already are compromised. And last but not least, a couple people and a few others have said to staff, what are we going to do when Jan leaves? And how are we going to stay safe? You know, Jan doesn't keep you safe. We keep you safe. And, you know, the team will continue to do so long after I'm gone. And we've got a great leadership team here. We've got a great line staff. They love you very much, just as I love you. And, you know, we'll get you through this. I won't be here, but you'll still be in my thoughts and prayers, get you through and keep you safe. So do we have any other questions coming in, Colin? Okay, good. So we have some more questions. Thank you, everybody. So may we drive to Publix and bring our groceries home ourselves? So what I'm going to say to you is independent living residents, I can't stop you from doing things such as driving to Publix. If you choose to still take that chance and want to bring your groceries back yourselves, yes, you can, but you must go through the screening process at the front desk before you go up to your apartment. So you will be getting your temperature taken, and you will be filling out a form that answers those questions we've been asking folks to answer. Please be aware, public deliveries take several days, is obviously a comment. Okay, so that means that we have to be good planners and prioritize. So if you know that you need something, for instance, my husband does our shopping. I only want him to go once a week because I don't want him exposed and I don't want my mother exposed. So we get together and we figure out what list we're going to need. We go through our stuff. And we don't want to hoard anything because people need those supplies as much as we do, but we do think ahead. So right now we're thinking about laundry detergent because we know that's the next thing that's going to be taken off all the shelves. So we just have one backup bottle of laundry detergent. He got that today, and that's how we do things. So you're going to have to plan and prioritize once the shop is open, little grocery store. It'll be a little easier to keep your milk and bread and eggs and those kind of things close. So when will milk be available here? So milk will be available through the grocery store, and that should be hopefully by the end of this week. Will there be adjustments made to our monthly fees due to the reduced transportation and housekeeping? The reduced transportation, no. The housekeeping services, our CFO is actually looking at what can be addressed, or what can be proposed to be able to get that. That is all I know about that. Great questions. Do we have any other? Okay, anything else coming in? So we'll give you a couple more minutes if you want to call in your questions. We want to be able to answer those questions for you. If we continue to get more questions, we can definitely do this again. I know that I don't mind the Jan and Julia show. We can make it more entertaining if you want. Put in requests. We can bring people in to sing and dance, whatever. But we need to laugh as well as be so serious. So we want you to hear the message from us.
So one of the things we did learn on the call today is that Tuesdays will be Common Prayer Day all across all the community, asking all chaplains and or retired clergy to submit prayers that they would want to use across the coming weeks, so that every Tuesday will be Common Prayer Day. And it was suggested that if we wanted to have an individual prayer day on our own campus, that could be arranged as well. But for right now, the Common Prayer Day will be Tuesday. And watch tomorrow. The prayers will be posted in various places. Hopefully, maybe we can even get it on TV. But it's definitely going to be on My W Life. And that might be something that many of you, or all of us, are interested in. Some of their communities are planning different activities, different games, different kind of entertainment. As these things come across, we'll pass that. It usually comes through the council chairs, and as they come across my computer, I'll get them to Colin and Andy, and we'll see if they're something that we want to become involved in. But if you think of anything, for example, some communities are doing a trivia night or trivia day. So think about that. That might be something that we could think about. And it might be fun if you just want to be the one who plans for the trivia questions. So think about that and anything similar to that. And any other suggestions that you have, just, get them to me in my box. I'll get them to Jan and the appropriate people, and we'll get back to you. So open communication as much as possible. Corporate is being extremely transparent about everything. And the main factor for us is to thank the staff, every one of them, even the 3 here in this room, for everything they're doing.
So Colin, don't forget, you can come on in, Colin.
Okay.
You are doing live 5 classes.
Yeah, it depends on the day. Today we had 5 live fitness classes. Tomorrow there are 3 live fitness classes scheduled. And as Julie said, Andy and I are working on non-fitness related activities that we can do, hopefully using the TV through groups, all kinds of different things. So our primary focus was making sure that this was readily available, live TV, to be able to get stuff like this on as far as programming going. So that's what we've been working on the past 5 days. So it was not easy, and we are the only community that has this, and that's so we're ahead of many of the other communities as far as being able to get live information to everyone. What I did want to say is there may have been a little bit of kind of buffering that went on for some people, or if you joined halfway through or couldn't see the whole thing, this will be up on My W Life immediately after this, so you can go on and you can click and watch all of it. There won't be any buffering through that way. And then additionally, we will replay this exact format, this exact presentation tomorrow at 3 p.m. for anybody who missed it. So anybody can watch it tomorrow at 3 p.m. on the channel 732 if you don't feel comfortable going on My W Live for any reason. Channel 732 tomorrow at 3 p.m. This exact same presentation will be going. So, and from that point on, as they mentioned, if you have any additional questions, get them to us and we'll see what we can do to get the answers out there.
Do I get royalties?
Yeah, I didn't know they were taping it, so I want royalties. But the other thing that we are also looking for those of you who have sewing machines and you are seamstresses, the big thing now is being able to sew masks for our staff and for the residents as well. If we get that many, maybe we can be passing out masks in time to residents. But right now we are short of masks, which we are using in our health center and our assisted livings. So if you are willing to do that for us, we have a pattern. We could probably get a hold of fabric for you. We would be glad to do all of that. But if you have a sewing machine and you are willing and can follow a pattern, which you would not want me sewing or following any patterns whatsoever, we would really, really appreciate the other Westminster communities are doing it as well. So we would love to have you come and see myself or Julia or Andy or Colin, whomever, and just be able to get that for us. So do we have another question?
Yes.
Menu choices at this point, no, but menus. What did they say today on the call? We would be getting menus. Menus will be coming out, so you at least know what's coming for food deliveries, but food selection, not at this point. No. Dr. Dunn would like to know if he can get some ice cream. Gosh, Publix delivers ice cream. I know that. And
$75. I have a quart in my freezer.
but yeah, and the little store down in Palm View has, I believe they still have ice cream as well. Yes. And, you know, if we could deliver ice cream in 20 minutes or less, unfortunately, we're delivering about 100 and what they say today at the morning meeting, 100 and some deliveries, 190 meals. So it keeps us all hopping to get them delivered. But we added ice cream to that. You'd have some melted ice cream. So great questions. Okay. Yeah, we will continue to do these if they're helpful. If we get more guidelines that the CDC is getting out to us, if things change in any way, shape, or form, we will be glad to do that. I'm sorry if you couldn't hear us. We tried to yell, but this is the best we can do. Hopefully, when they watch it again, the volume can be turned up and you'll hear us better. So, thanks everybody. We really appreciate you tuning in. God bless.